your artificial bone will get resorbed, your implant will get exposed, and there can be a secondary infection like peri-implantitis can be there. So just try to think yourself that the bone has resorbed naturally and the doctor is saying that they are going to put some artificial bone. You are going to have the successful implantation after having an artificial bone. Please understand, this artificial bone has its limitations are there. I am Professor Dr. Vivek Gaur. I am a maxillofacial surgeon and I am practicing in Kaushambi, Delhi NCR. My clinic name is Implant Clinic, and this clinic is specialized for doing a corticobasal implants. Corticobasal implants means immediate functional loading implantology, and we practice and we operate and we do the implant implants. They are the pioneers in immediate loading. They are the first in the immediate loading and they are from Switzerland. When you go to a dentist and after seeing actually the scans or doing a clinical examination, he find out and he tell you, oh sir, there is no bone is there. There's a limitation of the bone is there. So to place an implant, I just want we will be doing the bone grafting. You got confused. Okay, bone grafting because the bone is not there. Okay, you're going to do. So what is a bone grafting? Please understand, two type of bone grafting is there. One is the autogenous actually, and other is the artificial materials are there that is available, like allograft actually is there or alloplast materials are there. So just try to think yourself that the bone has resorbed naturally and the doctor is saying that they are going to put some artificial bone and you are going to have the successful implantation after having an artificial bone. Please understand, this artificial bone has its limitations are there. This artificial implant, the bone is not going to hold your implant, please understand. This artificial bone is just going to give some support for maximum 2 years. And then again the artificial bone will just vanish away. And your implant will be actually anchored in the bone, but there are the high chances there, when you have a more number of implants are there, the high chances are there, your artificial bone will get resorbed, your implant will get exposed, and there can be a secondary infection like peri-implantitis can be there. But there is a different type of a bone is there that is called an autogenous bone. Specifically, I am talking about the vascularized autogenous graft. The vascularized autogenous graft means when you have a very big major defects are there, we take a bone actually from the leg, from the hip, that is called a fibula or the iliac crest, and the other graft we take it, and it has to be supplied. It has to be there actually with the normal vascular supply. Then the vitality of that particular bone is get maintained, and that is good actually to have the to sustain the implant, but not as good as the native bone or the original bone was there. So please understand, when you go with the grafting material, why the dentist is talking about the graft? Because he is using this type of implant that is called a root form implant is there. This is a root form implant is there. Please understand. You check the design of the root form implant. It is wide at the front and tapering actually down. And I will show you one more implant. This is a corticobasal implant. That is the cap is there to hold actually the cap, and that is all thin, only wide at the other end is there. What does it mean? It means when I'm using this type of an implant, just because some part of the bone has been resorbed, the doctor is asking to put the graft material, which we know it's not going to be there for a long-term result after 2 years or 3 years of I'm just talking about 2 years, not more than 2 years. But I am using, let's have an implant that is not dependent upon actually the thickness at the crest level, means thickness at the above level. This is engaging the implant where always the bone is there, and that is why there is no grafting is needed. And there's a documentation proof is there. A case that is done without grafting is highly successful when you're going to compare with the case with grafting.